Eyes are one of the first areas to show aging. Some people refer to eyes as the windows to the soul. They are certainly the focal point of the face. An increased laxity of skin can portray a tired, sad, or melancholy appearance when in actuality we feel otherwise. Blepharoplasty surgery, or the eyelid tuck as it's sometimes called in layman's language, primarily gives us a more rested appearance by reducing the excess skin and fatty tissue which can develop in both the upper and lower eyelid areas with aging. The entire eyeball is surrounded by fatty tissue, which medically we call adipose tissue. With aging, the fatty tissue can bulge forward, especially in the lower eyelid, and form a hernia, just like in any other part of the body. The dark circles that people complain about are oftentimes not due to pigmentation changes in the lower eyelid, although that can occur in rare instances, but is usually due to the shadowing effect caused by this excess fatty tissue. This results in a convex bulging in the lower eyelid area that results in a concavity which causes a shadowing effect. This is the reason that the condition may appear to be more severe in various types of lighting. The condition may be worsened during a woman's menstrual cycle or when one is eating or drinking an increased sodium diet. Both of these conditions result in increased fluid retention by the body. The fatty tissue attracts this fluid, which results in increased bulging in this area. If the condition is detected early, the fatty tissue can be removed simply by using a laser on the internal part of the lower eyelid area and removing the fat without an external incision. This is called a transconjunctival blepharoplasty. The fatty tissue is removed and the skin redrapes into its normal position. However, if the condition has persisted too long and the skin laxity has markedly increased, then both skin and fatty tissue need to be removed. And this would be a traditional blepharoplasty or eyelid tuck. The appearance of our eyes is an individual characteristic, and it's due in part to the shape of the bony cavity or orbit. Some people have a very prominent superior-orbital rim, which affects the shape of the periorbital area. Little can be done to alter this bone structure. In some cases, the depth of our eyelid crease is determined by the amount of cartilage in the eyelid area. This is an inherent characteristic, and there is a limit to how much can be modified. For example, an individual with small eyelid fissures may be able to obtain significant improvement in appearance of their eye and a well-rested look, but may never be able to obtain a large, deep-set upper eyelid fold because of the anatomy. Individuals show changes in their eyes at various ages. The average person, as early as age 25, may have enough laxity in the upper eyelids that they can obtain significant improvement, and approximately 25 to 30 for the lower eyelids. However, the individual anatomy varies so greatly that a good rule of thumb on the time to seek eyelid surgery is for women when it becomes difficult to place eyeshadow on the upper eyelids, and for men and women when a good night's sleep doesn't get rid of the puffiness in the lower eyelids. Most often, the droopy eyelid is due to laxing the upper eyelid skin. Frequently, it may be due in part to an abnormality in one of the upper eyelid muscles. The small muscle called levator aponeurosis can sometimes lose its attachment to the cartilage in the eyelid or become dysfunctional with age. When that occurs, the eyelid can droop. This usually occurs unilaterally. In this condition, the muscle needs to be tightened as well as removing the excess skin and fatty tissue in the upper eyelid area. When this condition occurs, there can be significant improvement, but there's always going to be some asymmetry and slight difference in the position of both eyes. Eyelid surgery is usually performed under twilight anesthesia on an outpatient basis. The skin is removed and excess fatty tissue from the middle or medianmost portion of the eyelid is also removed. In some cases, the upper eyelid muscle may be contoured. The incision is closed with dissolvable sutures. There may be sutures that run underneath the skin, which are painless and can be removed at the end of a week. Approximately 1 week, the incision conforms to the natural contour of the eyelid and is hidden within the eyelid fold. Laterally, it falls into the fine creases in the outer portion of the eyelid. The lower eyelid incision is made several millimeters below the eyelid lash line. It's carried laterally into the skin fold. The skin and muscles are reflected down, and 3 fatty tissue pockets in the lower eyelid are opened, and excess fatty tissue is removed. The skin and muscle are then repositioned, and the excess skin is removed. The incision is closed with interrupted dissolvable sutures. Frequently, special tape is used to support the lower eyelid area for a week after surgery. And this helps to reduce the amount of swelling and bruising and allows an increased amount of extra skin to be removed more safely. The only problem in the lower eyelid is baggy fatty tissue secondary to that excess fatty tissue. Then a laser can be used to make an incision internally and to remove the fatty tissue, with the eyelid incision being made inside and no outside incision. If, however, the excess fatty tissue results in stretching the lower eyelid skin, then both fatty tissue and skin need to be removed, and the traditional blepharoplasty incision with an external incision is performed. Patients commonly ask, how long will eyelid surgery last? Because the tissues are removed, one will always look better than they would have had they not had the surgery. Fortunately, we continue to age, so there's always going to be some changes in this area. But we're fortunate that eyelid changes don't occur as rapidly after surgery as changes in other areas. This appears to be due to the fact that the fatty tissue doesn't recur and that the eyelid is located within that bony structure and appears to be protected somewhat from the gravitational effects and environmental effects of aging, in contrast to the cheeks, jowl, and neck area, which may need to have tuck-up procedures done at some point down the line after facial rejuvenation. Various types of chemical peels can be used to remove fine lines in the eyelid area and provide additional tightening effect to the skin. Each type of peel varies to the degree of wrinkle removal and tightening that can be obtained. Some provide an increased lightening effect to the skin in the eyelid area. A new development in recent years has been the use of various lasers for skin resurfacing and skin rejuvenation in the eyelid area. Following eyelid surgery, an individual needs to sleep with their head elevated approximately 30 degrees for the first 2 weeks following surgery. They need to refrain from lifting over 5 to 10 pounds or activities which result in heart rate being elevated for the first 7 to 10 days following surgery. This will help to minimize the amount of swelling and bruising. Eyelid incisions are cleaned with hydrogen peroxide soaked Q-tips 4 to 5 times a day for the first week. The patient can wash over these areas and get in the shower as long as the shower does not directly hit the incisions. In fact, this is encouraged in order to increase the healing process. Makeup can be applied after 7 days. Applying makeup sooner can result in irritation to the incisions and should be avoided. Ice water soaked compresses are applied to the eyelid areas constantly for the first 48 to 72 hours following surgery. This is critical and helps reduce swelling and bruising, decrease the amount of discomfort, and to accelerate wound healing. Ice packs work well, but they don't contour into all the eyelid areas, and therefore increased swelling and bruising can result. This problem is eliminated with washcloths that are soaked in ice water. One needs to limit eye movement for the first 48 hours after surgery. This means that they should keep their eyes closed as much as possible and use the cold compresses. If an individual is reading, watching TV, or doing paperwork immediately following surgery, each time they blink the eye, they're stretching and pulling the incision lines. That obviously is going to decrease the healing and result in more swelling and bruising. During the first 48 hours, the patient should have as much eye rest as possible. Most patients find that at the end of 1 week, they can resume their normal activities and have significant improvement in their appearance as compared to the before surgery. Makeup can be used to camouflage the minimal swelling and bruising that occurs in some patients. If transconjunctival blepharoplasty is performed, patients can often return to normal social work activities within 48 hours. The advances in laser technology allow this surgery to be performed with much less discomfort, bruising, and swelling. However, this procedure can only be done if there's good elasticity of the lower eyelid skin.